So if you were looking at literature, or if you're looking at your KPIs or your audits currently, traditionally we've defined IVF success as live birth per cycle started, per oocyte retrieval, and per embryo transfer. So you start a cycle, you have an oocyte retrieval and the first embryo transfer, whether it is successful or not successful, and that is the traditional definition of live birth, which is again used even now. But in addition to that, we've been lucky, we've been fortunate that there have been quite significant milestones in IVF. And those of us who have been in IVF for quite some time, say about 10 to 15 years, we have seen that over the time, we have seen significant improvements in ovarian stimulation strategies. There have been laboratory innovations, I'm sure you use across your labs in the IVF. There is cycle segmentation. We can do it much more confidently and therefore avoid any risks such as OHSS, and luteal phase support strategies. So there have been significant improvements across all levels, which has allowed us to redefine success, not just with the traditional definition which I have referred to before, but also introducing success in terms of cumulative live birth rate and time to pregnancy. An efficient IVF cycle would be one that has a higher cumulative live birth rate. And what do we mean by cumulative live birth rate? I'm sure all of us are aware, but just to refresh, cumulative live birth rate is live birth resulting from all embryos created from that cycle censored when the first live birth occurs. So all the oocytes resulting in good quality embryos, even if the first embryo transfer does not result in a pregnancy, you have embryos from that cycle that will increase your cumulative live birth rate chances by undergoing minimum required number of stimulation cycles, or if it is a good prognosis patient, perhaps just the one ovarian stimulation cycle. Also, we want to shorten the time to pregnancy and live birth. And obviously, makes sense that if you have a shorter time to pregnancy and live birth, then it will result in less patient burden, and also it is more cost effective. So let us try and understand some associations between the number of oocytes and IVF outcomes, because ovarian stimulation, we are aiming to increase the number of oocytes. And how does it relate to preclinical outcomes or the laboratory outcomes in terms of embryo quality, embryo euploidy, and also the clinical outcomes, that is live birth in a fresh transfer cycle. We still do fresh transfer cycles, so how does it correlate? The number of oocytes to live birth in a fresh transfer cycle, and cumulative live birth rate, which we have defined in the earlier slide. So this is a systematic review and meta-analysis where they're looking at number of oocytes and the preclinical outcomes and what they found. So on the x-axis, so across horizontal is the number of oocytes retrieved, and on the y-axis is the laboratory outcomes. The laboratory outcomes are metaphase 2 oocytes and number of fertilized oocytes and number of euploid embryos. And what they found is that all the lines you can see are going up and they're diagonal, and different colors indicate different studies. And what it shows is that the number of oocytes is positively correlated to number of metaphase 2 oocytes. So the number of oocytes is positively correlated to the number of mature oocytes, fertilized oocytes, and also euploid embryos. And also, again, it is positively correlated. So you can see all the lines in the same direction going upwards, showing a positive association with good quality embryos both in the cleavage stage and also in the embryos when reaching the blastocyst stage. So more oocytes, better laboratory outcomes across all levels. That is M2 oocytes, fertilization rate, your cleavage stage embryos, blastocyst stage embryos, and also good quality euploid embryos. So how does it translate clinically? And this is a study we did quite some time ago. And what the main aim of the study is to see how the association is between the number of oocytes retrieved following ovarian stimulation and live birth in a fresh transfer cycle. And what we found from this study, and we demonstrated for the first time, that there is a very strong association between ovarian stimulation, number of oocytes retrieved, and live birth in a fresh cycle. And if you're looking at local